More than 100,000 Americans died of drug overdoses in 2021. Fentanyl, a potent synthetic opioid, quickly became the leading cause of overdose-related deaths. In his State of the Union address this month, President Biden pointed to the spike in fentanyl-related deaths and called for stronger penalties to deter the flow of the illicit drug into the country.
Fentanyl is killing more than 70,000 Americans a year. So let's launch a major surge to stop fentanyl production and the sale and trafficking with more drug detection machines, inspection cargo, stop pills and powder at the border.
In the 2022 fiscal year, U.S. Customs and Border Protection said it seized over 14,000 pounds of fentanyl. Biden's remarks directly preceded calls from Republican attorneys general asking for more to be done about fentanyl through the criminal justice system and to designate foreign drug cartels as terrorists. But critics of more punitive approaches to drug use and possession say a proven method to address the crisis is harm reduction, a method of helping people who use these substances stay alive. The FDA is currently considering making naloxone, an overdose reversal medication used in harm reduction practices, an over-the-counter drug and more widely available.
The Biden drug control strategy, for the first time in the history of the United States government, recognizes harm reduction as an important tool that includes naloxone, includes testing strips for fentanyl, as well as student service programs, in addition to expanding treatment, recovery, and prevention. Because to add those pieces is the second part of the same coin. We need to be looking at it as one coin where there's a challenges with supply and aspects, but also demand reduction is very critical.
New Mexico aimed to address the crisis in their state by signing into law an expansive harm reduction bill last year. The bill greatly expands what the health department can do to address potential overdoses. To talk about these approaches on a local level, I'm joined by Josh Swatek. He's the head of New Mexico Health Department's harm reduction program. Josh, thank you so much for joining me.
Thanks for having me today.
I want to start off by asking, what does a harm reduction approach mean?
So for us, a harm reduction approach really means meeting people where they're at. It means addressing substance use in a way that's kind and compassionate and really client-driven. We know that people are the agents of their own change, so we want to make sure that we're not pushing any sort of agenda, but we're providing services in that kind and compassionate manner to people.
The bill directs the Department of Health to distribute things like fentanyl test strips and naloxone, the overdose reversal drug. How does that reduce harm or affect outcomes when it comes to fentanyl use?
Yeah, with fentanyl test strips, it really lets people know who are using substances what is in their substances. We're able to provide that with education and naloxone distribution, like you mentioned, to help reduce the risk. If people use fentanyl test strips, then they're aware of that fentanyl might be in their substances, so they can change their behavior. They can use less. They might not use that batch at all. They can make sure that they're using with someone or using the never use alone hotline. And they're always given Narcan when they're given fentanyl test strips. Naloxone, the overdose reversal medication, has been really effective. New Mexico has been handing this out since 2001. And to give you an idea about how expansive the program, last year there were over 3,400 overdose reversals reported to the harm reduction program in New Mexico. This shows that this is very effective.
Critics of stronger criminal penalties for drug possession say that harm reduction is a proven method of reducing fentanyl use and should be better funded nationwide. How do you feel about that?
Harm reduction is one of the most proven and researched methods to address substance use in the world. The New Mexico Department of Health has been using harm reduction for over 25 years as of this month, and it has proven effective. As the large mountain of research has shown, as our program's effectiveness has shown, it really helps individuals have a healthier life overall when they're using substances.
According to 2020 CDC data, New Mexico was ranked 11th in the nation for overdose death rates. How has fentanyl changed your approach to harm reduction?
The nature of substance use has changed dramatically here in New Mexico. It's changed primarily from black tar heroin and methamphetamine to individuals smoking fentanyl pills. What we've done to address that is we've passed legislation here in New Mexico to give the harm reduction program the authority to provide additional supplies so that people will come to us so that they can use in a more safe manner. And we can also provide them with the health messaging based upon what they need that day. This change really hit us in about 2019, and we responded to it as soon as we were able to with the legislation.
How is fentanyl different from other opioids?
Sure. So fentanyl is, for here, it's primarily smoked instead of injected, which changed again the supplies that we had to hand out. Fentanyl is also significantly stronger than the heroin or morphine that folks have been using for a while. It also doesn't have as long of an effective period, so people are having to use more often when they have a dependency. So, in order to avoid the withdrawals associated with substance use dependency. So those are things that we've seen and that have complicated the approaches that we've had. But the fundamental harm reduction approach is still very effective. We are seeing those overdoses increase over time. It is a fundamental change from what the substances were here in New Mexico. So yes, it because of its stronger nature, there are increased consequences associated with fentanyl being in the supply of substances here.
What more do you think could be done to address fentanyl and fentanyl use in New Mexico?
I think we're doing a pretty good job here in New Mexico. We're addressing substance use. We're increasing access to behavioral health. We're increasing access to education. We have at this point, over 58 locations all across the state where anyone can come to us for services.
Josh, in the State of the Union this year, President Biden addressed fentanyl as a border issue, but the scope and the fatal consequences of fentanyl use are much broader than that. How do you feel fentanyl is more than a border issue?
Yes, it's certainly a broader issue than a border issue. As we've seen across the nation, fentanyl overdoses have increased. So while there might be border components to it, this is really about substance use in general. Addressing the underlying causes of substance use is really what we're focused on, the Department of Health, using proven, scientifically backed methods to address overall substance use. I think that's what really should be focused on.
You mentioned earlier that you have over 58 sites across New Mexico, and you've also mentioned that there are mobile sites. Why is it important to go to people when it comes to drug usage?
So the whole principle of harm reduction, of meeting people where they're at, is figurative, and it's also literal. We need to be going to where people live. We have a large rural community here in New Mexico, and folks might not necessarily drive into town to receive services. We want to make sure that folks have as low barriers as possible to access life-saving naloxone and other harm reduction services that our program offers.
For the people who pull the political levers, whether it's in Washington or in state politics, what would your feedback be to them when it comes to harm reduction and the state of fentanyl use in New Mexico?
I would certainly say, like here in New Mexico, the state legislature and the multiple administrations here have supported harm reduction, and it's worked. Looking to the science, looking to the strong background and history of public health programs to address any substance use, not just fentanyl, would be the key to addressing fentanyl and other substances that might come up in the future.
Josh Swatek, head of New Mexico's Health Department Harm Reduction Program. Thank you so much for joining me.
Thank you very much, Nicole.